I love this, and I do want to talk a little bit about those small organizations and maybe even the idea of like there's a need to minimize headcount because there are so many good ideas right now. There's not enough trained technical operations people to go around. Perhaps AI is going to be one of the bridges to allow one CTO to do a lot of work all at once.
It is, but I'll tell you, we had a conversation today about proactive quality with a gentleman from AstraZeneca in room 2. And I have to say, I wrote down 80 ideas from that conversation. You could apply those ideas at a small level or a large level, but they have taken down to the shop floor. Typically, when a new operator starts, and they need 6 months of technical training. If you're going to work in a sterile filling room, you might need 6 months of training and education, of reading procedures and going to workshops and maybe working in a little modular lab, 6 months before you actually contribute to the company's bottom line. 6 months. Mm-hmm. They have taken away all of that training, that style of training, which is the old-fashioned methodology, and they've gone to a virtual experience so that you start working within about 6 weeks and everything that you've trained on is in a virtual environment. So now an operator knows he's going to be working or she's going to be working in a sterile suite, and it takes 6 weeks to be up and running. And the accuracy and the enablement, because he was talking about an example of hand washing. He said, I took the training, and the cameras watch you. And he said, when you wash your hands before you gown up, you must wash your hands for 30 seconds. And you have to wash the tops, the bottoms, every little nook and cranny of your hands before you gown up and glove up. He said, I failed 5 times.
Wow.
You can't do a human effectiveness check. If I watched you do that 5 times, I would miss what those cameras picked up. Mm-hmm. I was fascinated.
And as you say, in a virtual environment, they can be hands-on in real time.
In a very short period of time.
And everything except the output is real, right?
Yep.
Because they are doing all the processes and the data being collected is right. And so they could say, hey, if this batch had gone out, it wouldn't have been effective.
Right.
What are we going to learn from that? Instead of waiting 6 months before you put someone in dealing with a real product.
Exactly. It was fascinating. So I really think that we're at a place where at the shop floor level, there are technologies now that are going to be enablers. I think it's going to allow you to bring new people on board. I think it's going to decrease the number of issues they have performing their jobs well, because they will have learned techniques from videos and virtual experiences that will teach them how to wash their hands, which will control the opportunity for any microbial counts because of oopses during production. Mm-hmm. I think actually that we're going to move to a place where even in the laboratory and at the shop floor level, we will be able to enable people to be much more successful. And from a safety, a quality, and an operational efficiency perspective, it'll be a very different kind of environment, and there'll be tremendous savings. But as this guy said, you track those savings at very small incremental levels, right? Every one of those little changes that you make across your workforce makes a difference, and when you add all of that up, it begins to make a very big difference.